Hey, welcome back to Following Science, where I delve into the latest and most fascinating topics in the world of science and medicine. I'm your host, Rutu Raparl, and today I'm going to be tackling a subject that affects millions of people around the globe, Alzheimer's disease. Alzheimer's disease is a complex and devastating neurodegenerative disorder that leads to progressive memory loss and cognitive decline. It is the most common form of dementia, a category of diseases that causes a decline in memory, reasoning, and other cognitive functions. Today, I'm going to deep dive into what Alzheimer's disease is, its causes, symptoms, diagnosis, treatments, and the latest research in the field. So, let's get right into it. Let's start with some foundational knowledge. Alzheimer's disease is named after Dr. Alois Alzheimer, who first described the condition in 1906. Dr. Alzheimer discovered it through his examination of a brain of a woman who had experienced severe memory loss and confusion. He observed unusual clamps and tangled fibers in the brain tissue, which are now recognized as hallmark features of the disease. Alzheimer's disease primarily affects the brain's ability to function properly. It involves the gradual degeneration and death of brain cells. This degeneration leads to a decline in cognitive abilities and memory, and eventually it can affect the person's ability to carry out everyday activities. Now, the symptoms of Alzheimer's disease can vary, but they generally start with mild memory loss and confusion, which gradually worsens over time. Early signs might include difficulty remembering recent events or conversations, or repeating questions or statements, or misplacing items and being unable to retrace your steps back to them, or things such as difficulty in performing familiar tasks, or getting lost in familiar places, or also just problems with word finding, visual spatial issues, and impaired reasoning or judgment. Now, as Alzheimer's disease progresses, symptoms become more pronounced and can interfere with daily life. These middle-stage symptoms may include things such as, first, increased memory loss and confusion. Second, difficulty recognizing friends and family. Third, problems with language and communication. Fourth, disorientation and inability to understand time or place. Fifth, changes in sleep patterns, such as sleeping during the day and becoming restless at night. 6. Increased risk of wandering and becoming lost. And lastly, 7th, personality and behavioral changes, such as delusions, paranoia, or impulsive behavior. Now, in the last stage of Alzheimer's disease, individuals lose the ability to communicate, recognize loved ones, and perform basic self-care tasks. They may require around-the-clock care. Late-stage symptoms such as these can include things such as, first, severe memory loss and confusion. Second, inability to communicate. Third, weight loss. Fourth, seizures. Fifth, skin infections. Sixth, difficulty swallowing. Seventh, increased sleeping. And lastly, eighth, lack of control over bowel and bladder. Now, the exact cause of Alzheimer's disease is not fully understood, but researchers believe it results from a combination of genetic, environmental, and lifestyle factors. Let's explore these factors in more detail. Now, Alzheimer's disease is characterized by two main pathological features in the brain. First, starting with amyloid plaques. These are abnormal clusters of protein fragments that accumulate between nerve cells. They are made up of a protein called beta amyloid. These plaques disrupt communication between brain cells and trigger inflammation. Then there's neurofibrillary tangles. These are twisted fibers of a protein called tau that build up inside of nerve cells. These tangles interfere with the cell's ability to transport nutrients and other essential substances, leading to cell death in the end. Now, genetics also plays an important role in the development of Alzheimer's disease. There are two types of genetic risk factors, starting with, first, early onset Alzheimer's. This form is rare and occurs in individuals younger than age 65. Then there's late onset Alzheimer's. This is the more common form and typically develops after age 65. The APOE gene, specifically the APOE4 allele, has been associated with an increased risk of developing late-onset Alzheimer's. Whereas in early-onset Alzheimer's, it's often linked to mutations in other genes such as APP, PSEN1, and PSEN2. Then there's environmental and lifestyle factors, and several of these factors may influence the risk of developing Alzheimer's disease. Some include things such as cardiovascular health, where conditions like high blood pressure, high cholesterol, and diabetes can increase the risk. Then there's education and mental activity. Lower levels of education and less engagement in mentally stimulating activities may contribute to a higher risk of getting Alzheimer's disease. And thirdly and lastly, it's lifestyle choices. Smoking, excessive alcohol consumption, and lack of physical exercise can also increase the risk of getting Alzheimer's. Now, there are also other additional risk factors that may contribute to the development of Alzheimer's disease, including things such as, first, age. The risk of Alzheimer's disease increases significantly with age, especially after age 65. Second, family history. Having a parent or sibling with Alzheimer's increases your risk of getting Alzheimer's disease. Third, Down syndrome. People with Down syndrome are at a higher risk of developing Alzheimer's disease than those that don't, and they often get diagnosed at a younger age. Then fourth, head injuries. Severe or repeated head trauma has been linked to an increased risk of Alzheimer's. And lastly, gender. Women are more likely to develop Alzheimer's disease than men, partly because they tend to live longer. Now, diagnosing Alzheimer's disease involves a comprehensive evaluation to rule out other conditions and confirm the presence of Alzheimer's-related brain changes. A doctor will assess an individual's medical history, symptoms, and changes in cognitive function. Now, this also includes asking about things such as family history and conducting interviews with family members or close friends. Now, they also use a bunch of tests to assess an individual's history. And some of these tests include things such as neuropsychological tests, where these tests assess memory, problem-solving abilities, attention, language, and other cognitive functions. These tests then help determine the extent of cognitive impairment and differentiate Alzheimer's from other types of dementia. Now, they also use techniques like MRI, CT scans, and PET scans to identify brain changes and rule out other conditions such as strokes or tumors. PET scans can also detect the presence of amyloid plaques and tau tangles in the brain, which also helps in diagnosing Alzheimer's disease. Now, research is ongoing to identify biomarkers in blood and cerebrospinal fluid that could aid in early diagnosis. These biomarkers can include beta amyloid and tau protein levels, which are indicators of Alzheimer's disease. Genetic testing can identify mutations associated with early onset Alzheimer's and assess risk for late onset Alzheimer's based on the presence of the APOE4 allele. However, genetic testing is not typically used for routine diagnosis, especially when you're not suspicious in a sense that you have Alzheimer's disease. Now, there is currently no cure for Alzheimer's disease, but treatment is aimed to manage its symptoms and, of course, improve quality of life. Let's explore some available options. There are several medications that are already existing to help manage the symptoms of Alzheimer's disease. Starting with memantine. This medication regulates the activity of glutamate, another neurotransmitter involved in learning and memory. It is often used in combination with different types of inhibitors to help manage symptoms of Alzheimer's disease. And then there's antidepressants, anxiolytics, and antipsychotics. These medications can help manage behavioral symptoms such as depression, anxiety, agitation, and aggression. Now, there's also non-drug approaches that can also support cognitive health and overall well-being. These interventions may include things such as, first, cognitive therapies. Activities and exercises designed to stimulate the brain and maintain cognitive function. Then there's behavioral interventions, where they use techniques to manage behavioral symptoms and improve communication. And lastly, there's lifestyle modifications. They encourage regular physical exercise, a healthy diet, and social engagement, which can end up having positive effects on cognitive health. Now, caring for somebody with Alzheimer's disease can be challenging, and caregivers need support too. Resources and strategies for caregivers specifically include things such as education and training, where learning about the disease and effect of caring techniques can actually be super helpful. Then there's support groups. Connect with other caregivers for emotional support and practical advice. It can be really helpful to learn from others and how they've been living with somebody with Alzheimer's disease and how it's been like for them. And then there's respite care, which are temporary care services that can give caregivers a break. And lastly, there's professional care services, which include people such as home health aides. There's also adult daycare and long-term care facilities that can provide additional support for people with Alzheimer's disease. Now, researchers are actively studying Alzheimer's disease to better understand its causes and develop new treatments. Let's explore some promising areas of research. Now, starting with genetic studies. Genetic research aims to identify new genes associated with Alzheimer's disease and understand their role in the disease development. This can lead to new targets for treatment and preventive strategies. Then, there's biomarker development. Identifying biomarkers for early detection and diagnosis is a major focus of Alzheimer's research. Advances in biomarker development can lead to early intervention and improved outcomes. And then there's disease-modifying therapies. Researchers are investigating treatments that target the underlying disease mechanisms, such as amyloid plaques and tau tangles. Some experimental therapies aim to reduce the production or aggregation of beta amyloid or tau protein. Now, then there is preventive strategies. Exploring ways to reduce the risk of Alzheimer's disease through lifestyle changes and interventions is another key area of research. Scientists are investigating how changes in diet, physical exercise, cognitive training, and cardiovascular health can help impact the risk of developing Alzheimer's disease in a negative way. So, in short, help stop the development of this disease by focusing on lifestyle changes, things that we can actually control. And then there's clinical trials. Clinical trials are crucial for testing new treatments and therapies. Researchers conduct trials to evaluate the safety and effectiveness of new drugs, interventions, and diagnostic tools. Some of the current trials are focusing on things such as monoclonal antibodies, which are designed to target and remove amyloid plaques from the brain. Then there's also gene therapy, which are experimental approaches used to correct or modify genes associated with Alzheimer's. And lastly, there's lifestyle interventions. Studies are examining the impact of diet, exercise, and cognitive training on Alzheimer's risk and progression. Now, living with Alzheimer's disease, as I mentioned before, presents some significant challenges, not only for those who are diagnosed, but also for their families and caregivers. Understanding these challenges can help provide better support and resources. Starting with emotional impact. Receiving a diagnosis of Alzheimer's disease can be emotionally overwhelming. Individuals may experience feelings of grief, frustration, and anxiety, which is why it's important to provide emotional support and counseling to help manage these feelings. Then there's daily life and adaptations. As the disease progresses, daily activities may become more difficult, which is why adaptations and modifications can help individuals maintain their independence and quality of life. These include things such as assistive technologies, where you can use devices such as GPS trackers, medication reminders, and communication aids to help you in this process. And then lastly, there's also environmental modifications, where you can simplify the home environment and use labels and memory aids to help reduce confusion and enhance safety. Now, planning for the future is crucial for individuals with Alzheimer's disease and their family. Legal and financial planning may include things such as advancing directives, where legal documents outlining medical care preferences and appointing a decision maker can happen to ensure that the person who is diagnosed with Alzheimer's disease is taken care of in the future. Then there's also power of attorney, which is basically designating somebody to manage financial and legal matters for the person with Alzheimer's disease. And lastly, there's estate planning, organizing financial assets and making arrangements for long-term care. Now, support from the community can also play a significant role in the well-being of individuals with Alzheimer's disease. Community resources, as I mentioned before, can include things such as support groups, respite care services, and educational programs. Now, raising awareness about Alzheimer's disease is essential for improving understanding, reducing stigma, and supporting research and advocacy efforts. Here are some key aspects of public awareness and advocacy, starting with awareness campaigns, which aim to educate people about Alzheimer's disease. Then there's advocacy for research funding. Advocacy efforts can focus on increasing funding for Alzheimer's research, which in the end just helps benefit bringing new treatments for this disease. Then there's policy and legislation. Advocates will work together and can work together to shape policies and legislations related to Alzheimer's disease, including things such as funding for research, access to care, and support for caregivers. Now, as I wrap up today's episode, I just want to mention some key takeaways about Alzheimer's disease, which is a progressive neurodegenerative disorder characterized by memory loss, cognitive decline, and behavioral changes. Now, symptoms for this range from mild memory loss to severe cognitive impairment with distinct stages of progression. Now, there's also a combination of genetic, environmental, and lifestyle factors which contribute to the development of Alzheimer's disease. And diagnosis involves a comprehensive evaluation. And of course, while there's no cure, treatments and interventions are aiming to manage these symptoms and improve quality of life for the people that are diagnosed with this disease. Now, ongoing research is also exploring new treatments, biomarkers, and preventive strategies, with clinical roles and clinical trials playing a crucial role in advancing knowledge and therapy. Now, adapting to daily life as a person with Alzheimer's disease or a caretaker of somebody with it, and planning for the future and seeking support are essential for any of the people I mentioned before. Then also there's public awareness and advocacy. Raising awareness and advocating for research and funding and policy changes are critical for addressing the impact of Alzheimer's disease. Alzheimer's disease is a complex and challenging condition that affects millions of people worldwide. And while there's no cure at the present, ongoing research and advancements in understanding the disease are paving way for better treatments and potential preventive strategies. If you or someone you know is affected by Alzheimer's disease, it is essential to seek medical advice and support. There are so many resources available to you, so use them. Now, as I wrap up this episode, I just want to thank you all for joining me on this episode of Following Science. I hope you found this episode and this discussion informative and insightful. Don't forget to subscribe to my podcast for more information exploring the world of science and medicine. Until next time, stay curious and keep exploring. I'm your host, Rutu Raparel, and this has been Following Science.